So today I'm just going to go through some scenarios with lower back pain. I know lower back pain is something that affects 80% of us in our lifetimes, and at some point we are going to land up having some backache, and it's how we handle it in the beginning stages that will determine how we survive our back pain and how we cope with it. So I just want to run through a scenario with you so that you can kind of get an idea of what is normal and how low back pain presents when it first hits. It usually happens after a prolonged posture in one position and when you're immediately forced into the opposite position. So if I can give you an example, we have people that have been sitting at a desk all day, leant over the computer, working over the laptop, sitting in meetings all day. Then you come home after sitting in traffic for an hour or so, you've been stuck in that forward flexed posture. And when you get home, your little kitty is so excited to see you, they come running up to you and you pick them up and lift them up over your head, and suddenly you get that sharp stab in your back and you don't know what to do. You kind of put your child down, you lost for breath for a little bit, you start to panic, you have a lie down on the floor, you think that's the firmest surface you can lie on, you try and wait for things to settle, and while you're lying there, everyone's panicking around you, like, are you okay, what's happened, what can I do for you? Meanwhile, your breath has been taken away, you can't even breathe. And then as you start to relax there, you start thinking, oh my goodness, is this exactly what happened to my dad? Like, he landed up in hospital, he had surgery, is this where I'm going? Oh my goodness, I think I can feel pain going down my leg, what's happening to me? It must be a pinched nerve or I've slipped a disc. You start to think of all the advice that you've heard from your granny about how arthritis runs in the family, and maybe that's what you've got now. Our brain kind of goes through those waves of panic, and that's completely normal. It's our body, your body has had this danger signal and there's a memory attached to it, or some kind of advice that you've had in the past, or someone that you've seen suffer with this kind of pain before. And I want to let you know that that is completely normal. That is our body's way of telling us that there's a danger signal that's gone from your back to your brain that's telling you, ooh, whatever you did really hurt me, and I need to stop you now. You need to take a chill pill and you need to lie down and be calm and let this pain settle. And it's very important that during this time we do allow our bodies to settle down. You can have a lie down on something firm, you can take some time out and have a bit of a lie down, treat it with some painkillers, grab an ice pack. All of these things are good to try and calm that system down and to try and calm that back pain down. And that should last for about a day or two. If you're lucky and it was just a sudden pang and some muscle spasm, it'll settle down within a day or two and you'll be up and moving again. It's important to get moving again. Those joints are mobile, they like to move. Muscles like to move. So during this time, although it's really difficult to get going, you can take those first day or two or three to take things calm, to lie in bed and keep calm. But after that, you do need to keep moving. And even while you are lying in bed or taking it easy for those first few days, you'll find lying down for long periods is also painful. It gets stiff and it gets sore, and we need to move within those times as well. So this video is just about dealing with acute back pain. So when that back pain hits you out of nowhere and you have no idea where it's come from, I'm going to show you a couple of things that you can do in those first 2 or 3 days just to try and keep the joints moving, keep the muscles relaxed, and to try and get you up and going again. Because there's nothing worse than being in pain. You become so fearful of movement, you don't want to bend, you don't want to pick up your child again, you definitely don't want to get in a car and drive again, you don't want to sit in a desk again because sitting feels like it makes it worse, walking around feels like it makes it worse, you don't actually know what to do. So I'm just going to go through a couple of things that you can do now at home to try and calm the system down, to calm those nerves down, and to get you mobile again. So let's give these a go and see how you get on. So I'd like to go through some precautions with low back pain. There are some cases in which you will need to have further treatment or further assessment. Often we've heard so many terms floating around like a slipped disc or a pinched nerve or fractures, or it's so painful that you think it must be broken. These are the only times that you will need to have imaging, and that is when there is unrelenting pain down your leg. So you don't get any relief. That pain is constantly going down your leg, and it's there when you wake up, when you go to sleep. If you sit, if you stand, if you turn over, that pain is sickening and it doesn't let go. That you have every right to go and get some treatment for that. That is a nerve root kind of pain, and that needs some medication to settle down. The other thing is if the pain is going into both legs or both feet at the same time. If you feel like your feet are stumbling, that you have no control over your feet and you're fumbling around and you're unable to walk, this is also a sign that there is something more serious going on and you need to go and get it sorted out. The other thing is that if you are losing control of your bladder or bowel, or you lose sensation in that area and you can't feel when you've gone to the loo or if you wipe after going to the loo, that is also a sign that there's something more drastic going on that needs some imaging, and that you have every right to get to the doctor and get it checked out. But for every other kind of pain there is, like the referred pain down your leg, into your bum, into your leg, something that is able to switch on and switch off, that you can get a comfortable position for, those kinds of things we can definitely settle down with some physio and with some exercises, and we'll get through to those. As soon as the inflammation settles down and you get that mobility back, the pressure starts coming off that nerve, it will settle down. So when you have acute lower back pain, it's very difficult to move. Everything feels like it's seized up, and that's exactly what has happened. You can imagine your back has been out of condition, and now that kind of sudden movement, it can even have been just getting up off the couch or picking up your slippers, that has caused everything to tighten up and seize up. So we're going to now try and do some mobility exercises to try and loosen up those muscles and get the joints moving nicely. So lying on a firm surface like this, you can either be lying on the carpet on the floor or a yoga mat or something like that, something firm. The bed doesn't usually work so well, but it depends on how you're feeling. So what you're going to do is lie on your back with your knees bent. This position is the best for your back. It's nice and supported. It's got a little bit of a flex in it, so you're not arching out too much, and the muscles already have a chance to calm down. You can use an ice pack wrapped in a tea towel on your back to also to calm down the inflammation and to settle down that nerve firing that's been going crazy in there. So try some ice on it first for like 5-10 minutes, let it settle down, and then you're going to try and do some of these exercises. So the first one that you're going to try is just a rotation. So you're going to get that movement in your spine to try and loosen up at a joint level. So with your knees bent and your back relatively flat on the bed, you're going to rotate your knees from side to side. So in the beginning, this might feel very stiff and very painful, and in that case, you're just going to do a very small movement. So if you can only do a couple of degrees both ways before it feels like it's seizing up, you just go to where you can go. So a little bit to the left, a little bit to the right, until you start to feel things easing up. And as things get better, you'll be able to go a little bit further. So this movement should be just up into that point zone of pain. Don't go through the pain, don't try and push it. We're just trying to calm everything down and to allow your brain to realize that actually movement is okay and it's not the end of the world. It doesn't have to seize everything up every time you move. So you would just kind of go to the point of where you can and then back off, and then the point where you can and then back off, until you're able to get all the way down to that kind of position, and then again that kind of position. So if you can't get that on the first day, don't worry about it. It's just to try and get things moving. You're just going to move as much as you can. The other thing you're going to do then now is, if you've done the kind of rotation movement, you're going to now do a tilting movement. So in this case, you're taking your pelvis towards you and away from you to try and get a flexion and extension in your spine. So if you feel where your hip bones are, you're going to first of all push them towards your thigh bones. So you're going to do a forward tilt like that, and you'll see that that arches your back. And then you're going to pull your hip bones towards your ribs, and you're going to feel that tilt that happens there. So you're going to kind of get that motion in your back. And you'll feel like if it's been painful, you either won't be able to go all the way into a fully tilted position one way or the other way, depending on how you've hurt your back. So you just got to go to the point where you can and then back off, and then go to the other direction to where you can, until you're able to get that full range of motion without any pain. So that's kind of where you would start. Sometimes it's very little and you can go all the way one way, but you can't go the other way. And you just kind of work until you can get that full motion again. So it's just working on a pelvic tilt. You don't have to move your legs or the rest of your body, it's purely in your hips. Obviously, back pain is a very distressing time, and we tend to then hold our breath. We forget that our diaphragm is also attached in there and part of your core, and when your system is so wound up and you're feeling so anxious, it makes the pain worse. So we need to breathe, we need to get oxygen to the muscles, we need to get oxygen to your brain, and you need to allow your brain to calm down and calm the situation down. So to breathe adequately, you can put your hands on your stomach. You would then take a breath in, and as you breathe in, you feel your stomach rise. And as you breathe out, your stomach must fall. And this is to try and get you to breathe normally, to calm your nervous system and to get rid of that anxiety. And out. So try taking 10 breaths also at a time to try and calm the system down and to try and relieve some of the pain in your back. The next thing we're going to do is to try and stretch out the hip a little bit. Sometimes you'll feel that pain goes down into the glutes and is starting to maybe give you kind of a vague pain down your leg. You're going to try and stretch out that hip and see if you can get some relief. So an easy way to do that, if you can, if it's not too painful, is just to pull one leg up towards you and allow the other one to fall. That's nice for flexion in your back as well, and it will help to stretch out that glute muscle that's gone into spasm. If you can try and pull your knee over towards the opposite shoulder, and that can also sometimes help to try and ease off that pain. So if you're feeling that glute pain or that pain that's starting to migrate down the leg, you can give that a go as well. So you would hold that for 20 to 30 seconds as you are able to do that. And you would do that on both sides. The other thing we need to try and get loosening up is the hamstrings and maybe a bit of that sciatic nerve that goes down the back of your leg as well. So what you're going to do is to keep one leg bent if you can handle it. If you can't, then you keep it bent. You're going to pull up that leg towards you and hold it behind your knee, and you're going to then start extending your leg up and down. And again, you're not going to go crazy with this. You're going to do 10 or so at a time, just to try and ease out that pain down your leg. If this makes the pain in your leg worse, please stop for now. It's not time. It will come later. Alright, and then relax. So those are the top tips for getting your back into moving action when you've just started suffering with an acute back pain. Those first 2 or 3 days while you're still very calm and taking things easy. Give those some time and give them a go and see how you get on.